Let's just begin by saying good morning, everyone, and thank you for joining us today. This is the Manhattan Family and Providers Information Committee. Um, I know we skipped a month there in meetings, so we're trying to make it up with today's meeting and another meeting next month. Ooh, went right past my introduction there. My name is Wendy DeLeon, and I am the co-chair of this committee, and I co-chair it with Luisa. Um,
Hi, good morning. I'm Luisa Eusse-Roche. I am from Care Design, and I've been co-chairing this committee with Wendy for, the last couple of years at least.
yes. And I am from Adapt Community Network. I forgot to add that on there. Wow, how time flies, a couple of years. That's amazing. And today we will be speaking to you about the changes to CDPAP in New York State, particularly how it impacts caregivers and home care services. But before we get started, we'd like to give people an opportunity to make any announcements on new services, any funding available through your particular agencies. So I know some of you may have put some information in the chat, but if you'd like to make those announcements now, um, please just raise your hand. We'll try to do this so that we don't speak over one another. Anybody?
We have a few providers on here, folks with opportunities for any of the services that you offer.
All right, I can get
Hi,
started if
good.
you guys want.
So,
Oh no, someone was speaking.
hi, good morning, ladies. My name is Uveen Morris, and I am case manager at Drags. You guys for even including me to be in this meeting. And I'm listening to the conversation when it comes to CDPAP. We do offer CDPAP at our agency as well, and it is crazy for my families. Half of them, they're not tech savvy, and the directions and the instructions that they're giving some families is just like really insane. And I don't foresee it moving smoothly along until possibly July to August, because the wait time just to get through, start the, yes, still get back to you. But let's be honest, a lot of our families they're busy. They don't want to wait on the phone as much as probably an hour, because that's what happened to me. I try to help some of my families, and it's like an hour you're waiting and you have to request a callback. So it's not all the time, you're able to help these families out. Luckily, you are going to be one of the facilitators on the list. So we have been sending letters back and forth. It has just been chaotic.
So you're talking about your experience and those of the families you work with PPL. Is that what you're?
Yes,
Okay, I'm
yes.
sorry because the audio, at least on my end, was going
Yeah.
in and out a little bit. Yeah, I mean, once we get into the presentation, we'd love to hear more about what people's experience has been. And we definitely will have time to discuss it. Um, if you have any information about your services, I understand there's home care on your identification that you'd like to
Yes,
plug in. This would be the time, and then we jump into the presentation and we can talk a little bit more about what everyone's seeing out there.
absolutely. So we're Brax Home Care. We are located in Brooklyn, and we service all five boroughs
Mhm.
as well as Nassau County. I'm over the special needs division, so I do assist with all of my IDG individuals, from helping them with a OPWDD, as well as, basically trying to get them evaluations as much as possibly can. Also, I have connections with ABA agencies, so a lot of the care managers, different CCOs that will contact me, and I'm able to assist them the best possible way that I can. Of course, my population as well as seniors, where we deal with the managed long-term care aspect of things.
Excuse me.
Yes, ma'am.
Sorry. There's a few people in the chat just commenting that it's a little difficult to hear you, and I myself am having some trouble. Would you be able
Oh,
to maybe speak a little bit louder, maybe a little closer to the microphone? It's a bit challenging to hear the words.
oh, I'm so sorry. Is this better?
Yes.
Okay, I needed to turn it up a little bit more. Yes, as I was stating, so I do assist with our special needs population with helping them provide services. Of course, my primary thing that I do is HHA, as well as assisting them to get in-home therapy services with different jobs that I have.
As possible. Great.
Yeah, I'm
One,
sorry. You cut off if you can still hear us, you cut off completely
Uh-oh.
at this point. Yeah.
Okay, I'm not sure. I think something is wrong with my AirPods. So I'm having a little bit. So
maybe you can put some of the services that you offer
I
in the
will.
chat,
I
and
will.
we'll
I will. Yes,
you
I
see
will.
Pat. Thank you so much. Pat, you had your hand up.
Yeah.
Good morning, everyone. Pat Lu, Family Support Coordinator from GHL. Hi. So I would like to make an announcement for our family support service. We have a case management service to assist family who is new to the system, and also the goal is get them into CCO, one of the CCO, and of course that during this time we'll assist them with their eligibility, make a referral for their evaluation, and also find out any community resource to help them to uh, navigate the system. And our staff, we can speak Korean and Chinese, and also we have another, I mean, it's ongoing service. It's a family's reimbursement service. It's good for it's for the goods and service. So anyone who is new to the system or looking for a family reimbursement, please contact me. I will put my contact information on the chat. Thank you.
Thank you, Pat.
Thank you, Pat. Anyone else? All right, I'd like to make an announcement. As a representative of ADAPT Community Network, so co-chair hat off, ADAPT Community Network hat on. So ADAPT Community Network offers a variety of services, but in particular, I'd want to mention we do have funding available for family reimbursement in Manhattan, but for those of you that support families in other boroughs, we actually have funding in all 5 boroughs at this time. So if you have not submitted an application for family reimbursement, or if you have, but you have not hit the limit of 3,000 per year, please do either reach out to one of the provider agencies with family reimbursement funds to see if there's anything else that we can assist you in getting reimbursement for at this time. Please do not leave it just for June unless you absolutely have to, because a lot of people do submit in June. And what happens is get a bunch of applications. It is a process. Everyone who's done it here can testify to that. It's a process. And then the time runs out, right? And if the time runs out, that's it. The state will not allow us to go past a certain date to consider applications. They may allow us to give you leeway to get maybe 1 or 2 more documents, but that doesn't mean we want to leave it to the last minute. So folks, please look through your receipts. For care managers, please reach out to your families, maybe a mass email, just as a reminder, hey, there's still funds available. Please let me know what you may need assistance with, or maybe an email with the contact information for the Family Reimbursement Department if you don't want to be bombarded by the 50 or so families on your caseload or whatever it may be, all contacting you at the same time to get this information out. In addition, we have home modification program, housing advocacy, overnight respite, day hab, ComHab, clinical services, and so on. Please contact Project Connect at projectconnect@adaptcommunitynetwork.org for more information. I'll also put that information on the chat. Lastly, through the Housing Advocacy Program, we do have a workshop coming up March 25th on housing supports, particularly how ComHab and family reimbursement programs can provide housing support. And I will put that flyer in the chat in a little bit for you as well. Thank you.
Thanks, Wendy. I think Dylan Valenzuela had their hand up first.
Your hand up.
Hi guys, sorry. Thank you so much for the space. I just wanted to introduce myself, Dylan Valenzuela from the New York City Poison Center. Just wanted to highlight that we have next week is National Poison Prevention Week, so we wanted to highlight that we have webinars on the 18th and the 19th on poison prevention in the home, and that's really for everyone in the community. A lot of times we just think about the Poison Center for just little kids, but really the reality is that the Poison Center is available for everyone. As a mom that has three neurodiverse children, everyone has different needs, and with specifically one of my children, he has pica. Everything goes in the mouth, everything, and the reality is that we need to just be aware that this resource is available, that it is for all families, and that the resource is available. The webinars are going to be in English and Spanish as well as Chinese. And if this doesn't work out, again, we offer webinars that are available, and we will be able to present to staff or even to families. I'm going to put my information in the chat. And again, all of these resources are free.
Thank you so much. Mary, I think your hand was up next.
Yeah, I was just going to add, Wendy was sharing the things that Pat was about family reimbursement, and I thought maybe, Wendy, you could plug the joint meeting we have set for April 23rd.
Third, yes.
Yes, April 23rd.
So the Manhattan Family and Provider Information Committee, or as Marco called us when the name changed, FPIC, and the Manhattan Family Support Services Advisory Committee are joining to present you with a webinar on, or a workshop on family reimbursement. We will be going over what the program is, goods and services that are covered, but also honorable mentions to the agencies that are currently providing funding for the program. Again, that'll be April 23rd, and email will go out with the link, but we use the same link. So if you were able to join this meeting, you can definitely join next month's meeting as well. And again, there's so much funding available for this. It'd be a shame for people not to apply. We all know that people have out-of-pocket costs, whether it be, $50, $100, $200. A little help here can help you over there. So please remember to apply. And if you're not sure if something's covered, reach out. We're more than happy to discuss. Either to the provider agencies themselves or your care manager, or Mary or Jackie. And we'll be more than happy to review those with you. So please be sure to also join us in April for that meeting. And Rocio, I see you have your hand up.
Thank you. Good morning, everyone. Thank you for this opportunity again. I typically doesn't bring this particular program, but today I want to highlight the parents with a special need. This is a program that is specifically for people who has IDD and has their own kids and living in their own home. Then we are supporting them with any skills that is needed. Some of these ones to support with raising their kids who maybe are all, it's a typical kids who has IDD themselves, and or they want support with behavior management, or they want support to apply for a job, or to communicate better with the family members, to advocate better for themselves, whatever is the skill that allows them to be more independent and more included in the community. We support them. This is in home services. Then if you have any person that has IDD and has their own kids and maybe will be benefit for these additional skills that they wanted to refine, we are here for that. I put it there, my direct number. Typically, I don't put in my direct number, but I just add here my direct numbers, and that way I wanted to make sure that whoever you refer, I will just get in contact about that. Thank you again.
Thank you, Rocio. Rocio, can I just ask, since I supervise care managers, is this a waiver service or a family support service? Maybe I missed it.
Family support services.
Okay, it's family support service. Okay, great. Thank you so much. And it's through, you'll put is there an email for you? I'm sorry, I might have missed it.
I put in my number, but I can just add in my email too. Okay? In
Thank
the
you.
bottom. But yes, definitely it's a wonderful opportunity to support our people to be more independent. And sometimes they don't want to identify themselves that they have disabilities, or they need any support, and then, but we are here for that. We have a few one that has a newborn, and then we support them even to how to report to the doctor, how to know any situation that they need support, how to really know the milestones for the kids. I mean, whatever it is the person who has IDD has the kids, doesn't matter the age, we really wanted to support them.
Thank you. We sometimes do find ourselves supporting young people or young adults that become parents and don't have a ton of support. So having somewhere where they can get that help is going to be really, really, really beneficial. I don't think everyone knows about that service. Thank you.
Yeah.
Mary, your hand was up.
It is, as I was just looking for Rocio's note in the chat, I saw that Delilah asked about guardianship for her son. Jackie and I are hosting a guardianship workshop. It's a 2-part series on April 9th. We'll go over the guardianship process with a lawyer from HRC who has an FSS contract with Family Support Services. The first one will be an overview of the different types of guardianship. And the second one, which you can attend if you went to the first one, is actually going over the petition page by page, because it's a very simple process when someone walks you through it. So Stephanie Barron will walk us through it, and that follow-up will be, I think, the second weekend in April. But I'll put my email, or Jackie and our email in the chat, and you can email us. We'll add you to our mailing list. That's it.
I just wanted to add real quick. So the first session is going to be Wednesday, March 26th, followed by the page by page on April 9th, Wednesday. And Mary will put it in the chat because Jackie doesn't know how.
And this isn't just for parents. Also, this could be for other providers or care managers, caseworkers, folks that also support families and individuals. Yes.
Thank you, Mary and Jackie. And just the last plug in, all the resources you've heard about here, I hope that you all are signing up for emails from the different agencies, or at least following them on social media to learn about services, any changes coming up, any workshops, webinars, events that you may want to attend. For example, Dillam, I know she sent, because I get them, she sends emails all the time with wonderful information. So please, if you are not doing so, please be sure to visit different provider agencies or committee pages and signing up for those updates, because wonderful things are happening. You just have to make sure you're in the know. And with that, one of the things that is happening is these changes to CDPAP. So Luisa and I we'll go over some of those changes with you. And as you've heard, some people already have some experience with the process, and may be able to add some information that we have not covered. So let me just start by sharing, and I'm doing a 2-screen thing here, so hopefully this will work. Can everyone see my screen?
Yep.
Yes.
Okay.
What does Omni for reduced fare look like?
Ooh, this is slow.
Looks good, Wendy.
I'm sorry?
Looks good.
Oh, thank you. So, some of the things we'll touch on today is just an overview of CDPAP. CDPAP stands for Consumer Directed Personal Assistance Program. For those of you that don't know, we'll talk a little bit about we'll talk about the recent policy changes in New York State, and then also on the impact on caregivers, people supported, and I'm sorry, they use the wording consumers. Noticed that on the website. So that's why you see it here, although we know that within the IDD community, we've moved on from referring to people as consumers, but I guess because you are sort of in a way purchasing a service, that is the phrasing that they are using, and home care services. So we'll talk about all those 3 things. And just want to get started by talking about what is CDPAP, just quickly. CDPAP is a Medicaid program as part of New York State Social Services. It talks about the implementing regulations under all the different sections and titles you see there. This program is meant to help people with disabilities, chronic illnesses, or other long-term health conditions stay at home with their chosen care and services. They can employ people they choose as personal assistants.
So you'll notice some terms that are floated around, right? The Department of Health, and then within our service system, we will at times call things by slightly different names, right? It's all alphabet soup. We throw around a lot of letters, we throw around a lot of acronyms.
Yes.
And it can be tricky as a parent, it can be tricky as a family member, but even as a professional, you could do this a very long time and not know what all of these things mean. Or from program to program, the same few letters mean something different.
Yes.
So we've tried to make a point of using the terms that the Department of Health and CMS were using with regard to these programs. However, please feel free to jump in if you're not sure what it means or what it stands for. So the 3 main types of home care providers in New York State, the 3 types of home care that you might receive, and this is not, by and large, not the only types, but these are the 3 that we are seeing the most, that folks are the most involved with, which would be the CDPAP caregiver, home health aides, which are HHAs, and personal care aides, PCAs. So those look a little bit different from each other, and we'll take a little bit of time to just explain the differences between them, because in this transition that we'll talk about a little bit later with CDPAP, and shifting over to the new fiscal intermediary, folks might begin exploring other types of home care that maybe they were not previously connected to.
Thank you, Lisa. Types of caregivers in New York home care services. These can be CDPAP caregivers. They're hired and directed by the consumer or their representative. can be family members or friends, except spouses, and allowed to perform medical tasks such as administering medication. And we do, I'm sure, have a lot of families that we work with that fall under CDPAP caregivers. I know when just a few years back, it was something that was being talked a lot, especially for during the pandemic when a lot of people were hesitant to go into an unknown person's house, right? And not knowing what to expect. There was a lot of talk about, well, maybe you would like to be a CDPAP caregiver. This is exactly what they were talking about. And mostly it was because you are allowed to perform medical tasks, which isn't usually the case for each one. There we go. It's a little slow there.
So home health aides, and we're not going to get into the specifics about the types of agencies that each of these types of things is connected to, because that could be a whole nother subsection of a presentation going into LICSAs and HHAs and all these other things. That's not the focus of the presentation. But home health aides as a service category is a certified professional that is trained to provide medical related supports. So there has to be a medical need. There's typically an assessment by a nurse that goes along with, and a medical form that goes along with the application to receive that service. They would work under the supervision of a nurse or another healthcare professional. You might have somebody else with a different license, but typically it's a nurse. And they might handle checking vitals, medication reminders. Notice that that's not so much medication administration, but reminders about medication, and basic wound care. Basic wound care would typically include minor scrapes and minor things of that nature. If there's any type of significant wounds that require medical attention, debridement, anything like that, that would not be something that a home health aide does. Which is really important, right? Because we support folks and we are parents and loved on the caregivers to folks that might need a more involved level of care that falls into a different category. So understanding the difference between those categories is important.
And finally, we have personal care aides, or PCAs. These are certified professionals like the HHAs. They have usually less medical training than an HHA, not typically a friend or family member, and generally focus on personal care and household tasks. And I know I personally, when my grandmother had a home attendant, because that's the phrasing we used, as I go through this, I realized that really what they were is a personal care aide, right? They never administered medication. My aunt was there. Really what they focused on was her personal care, sponge baths and things of that sort. But we use a lot of these terms interchangeably, and there are differences between them, which is why we thought it was so important to take time to just talk about the different types of caregivers, because it also allows us to understand what we can ask of these people that we allow into our homes, right? What services we can expect. And if you think that your loved one requires more attention or more care, that's a discussion to have with the medical professional in terms of why they were referred to particular service when you thought that they required maybe an HHA as opposed to a PCA.
And some of this on the provider side of things, when we are trying to build a robust service and support system around a person that is receiving services, we have to be mindful that the services don't overlap, right? These are Medicaid funded services. And you'll notice we didn't get into in-home nursing specifically, or home visiting nurses because that requires some differences in the person's Medicaid coverage, right? That changes benefits coverage. So we did focus on the ones that will typically work with the other services that the person is receiving within the OPWDD service system, right? Those services can work in between each other, but not overlap, right? And it's really important that you work out a schedule as an IDT, as an interdisciplinary team. So when conducting life plan meetings, when having circle of support meetings, really looking at what the schedule is and where people are receiving services, and that those hours don't overlap in the wrong places, because that can be an issue with regards to those services all being delivered. And there's some waiver providers on here, and there's some other folks on here that are really, really familiar with that. But at the very basic level, just understanding that we can't allow services to overlap because they're both billing Medicaid, and you can't receive two Medicaid services simultaneously.
And specifically for, we want to think about this with in-home services, right? Things like ComHab, in-home respite, you want to be very mindful. And also inquire, if you know that the person supported has these services, um, discuss it with them or their team, their support network, because it's very easy to get into 1, 2, 3 weeks of billing without realizing that someone's scheduled around the same time that the ComHab specialist or the in-home respite support is there. And the parent usually doesn't know. They're grateful that they're getting services because their loved one needs them, right? It's not to say that they don't need all these different types of services, but again, to just piggyback on what Luisa said, from a provider standpoint, we know that we can't be double billing Medicaid for the same service. So just make sure that there's follow-up questions. Sometimes you do have to be a bit of a Sherlock Holmes, if you will, a bit of an investigator whenever you hear certain things, or just straight out ask even if they haven't brought it up. Because I know that there are, especially with family support services, sometimes things that for whatever reason don't make it to the life plan, and it's usually because there's a bit of miscommunication or lack of communication between all the parties involved. So yeah, sorry, Lisa, just wanted to expand
No,
on that
that's
'cause
all.
I've seen
That's
it.
all really valid. And
Um,
inviting everyone to those meetings, to those life plan meetings, it becomes exceedingly important because you want to get a full picture.
Yeah.
And when it comes to getting services approved, any other type of service, you need justifications, and those justifications include schedules and what services people are receiving within a schedule. So really having a good setup for the team to share that information becomes critically important. There is
And
in
it-
the chat a question, sorry,
okay.
from Stuart regarding if the three services pay workers the same. Not necessarily. And that does, to some degree, lead into some of the changes that have come up. Home care agencies are reimbursed at the same rate for a particular service, but that doesn't mean that they pay their workers the exact same rate. That might vary from agency to agency depending on how they're set up fiscally. So, unfortunately, Stuart, the answer to the question is no, technically. CMS, Medicaid is paying the same amount depending on the type of service. So, HHA as a service, PCA as a service, CDPAP as service delivery, and that will go into it with CDPAP. But the reimbursement rates and everything are a little bit all over the place from service to service. It also depends on what they're doing. So, the more health related services are reimbursed at a slightly higher rate. I don't have those rates. That's something that we're not kind of prepared to share here, but I'm sure we can get that information if necessary. So understanding the differences between CDPAP and PCS. Consumers, people that are receiving the service, because again, it's not just people with IDD that receive these services. It can be anybody. It can be any of us, given a medical need. A CDPAP caregiver is called a personal assistant. So you might, when interacting with provider agencies that deliver these services, hear it called a PA or a personal assistant. That might be what they call the CDPAP worker, because it's consumer directed personal assistant program. So the title is technically personal assistant. PCS caregiver might be called a personal care aide. And that might be where, like Wendy had referenced, we might call somebody a home attendant. That's one of the terms that has been kicked around. That is a PCA. So CDPAP being consumer directed means that there's some flexibilities with who you choose and who that person is to you. With regard to that, there are some limitations, right? Like Wendy had said, it can't be your spouse. It can't be the guardian of somebody under the age of 21. And it can't be somebody's designated representative. But that will be something that by working with the new fiscal intermediary, folks will have worked out through that process. Folks should understand, though, that if you want to switch between CDPAP and move over to PCS, which is one of the choices that folks are going to be presented with throughout this process, you should understand that that is going to have an impact on how that service is delivered. So some of the changes that could happen are you might need new authorizations for services. Your caregiver might change. So if you switch over, there's a difference between having somebody that you fully select for those services and who an agency might offer as a person that delivers that service. How the caregiver is employed is going to be different, and that might change. So PCAs are selected, employed, managed, and trained by a home care agency. PAs are selected, employed, managed, and trained by you. So that is a very different level of engagement. It's sort of the difference to some degree, right? In a way that many of us understand the difference between traditional agency directed services and self-direction, right? The level of engagement that you as the person or family member representative of somebody receiving the service is engaged and responsible for a fair amount of that. Some of the changes that could affect the caregiver is the PCA has to meet certain qualifications to be the caregiver. Not everyone is going to meet those. So that's going to be training, background checks, evaluations. There's physicals that are required as part of this transition process. The caregiver will now work for a new employer. So that's going to be different. That's what's some of the things that are going to affect the caregiver. So if the person's caregiver is a parent, a neighbor, a friend, they are going to have a new employer on their check, right? That's different. CDPAP eligibility and services, however, are not changing. So what makes somebody eligible to receive CDPAP is not going to be different. That is not going to change. The change is the payer. So the statewide fiscal intermediary, the agency that pays out that service, there's only going to be one. So it's not going to be working for one of the local home care agencies. It is going to be working directly for PPL, which is the selected statewide fiscal intermediary that will take over. Wendy?
Sorry, it's a little slow for switching switching slides. So what is happening with CDPAP in New York State? Well, first, New York State Department of Health will use a single, as Luisa mentioned, statewide fiscal intermediary for CDPAP effective April 1st, 2025. This was decided to reduce fraud and waste in the program. All individuals receive, and I'm sure for several other reasons as well, all individuals receiving CDPAP and their aides will need to transition to the statewide FI if continuing CDPAP services. Home care agencies will no longer administer CDPAP. PPL is a statewide fiscal intermediary for all CDPAP services. And again, it's effective April 1st, 2025, although I understand the transition has to happen by March 31st of 2025. All current providers will discontinue providing CDPAP services by that date. And the transition started at least a couple of months back, even more than that. as we heard someone on in the meeting already, they've been helping families go through that transition, and I have spoken to several families who already have done all the paperwork. PPL does have their site up and running. They have a customer service number that's available 6 days a week. If I'm not mistaken, I saw a listing of like over 30 languages that they can provide information in. So all that's already available, and they are updating their frequently asked questions to try to address issues as they're coming up.
So what do members or designated representatives need to do as part of this process? So as Wendy had said, you have to make that registration happen by March 28th, which is very, very fast approaching. If you wish to make the change and continue, well, rather, if you wish to continue with CDPAP, you would make the change to the new fiscal intermediary. My understanding at this point is that folks are being given some options to choose to continue working with the home care agencies in a different capacity. Home care agencies are assessing whether or not the people that had been the CDPAP worker, the personal assistant, is qualified under a different category and be able to continue to work with them as part of that relationship. I think part of the reason that Wendy and I are presenting this information as non-home care providers is to try to present it as objectively as possible. So there are, depending on the position, folks might have some very strong preferences for remaining connected to a local agency, local home care agency that has been connected to them and a part of their services and a part of their care for a number of years. That is something that will be individualized and a conversation that folks have one-on-one. But for the level of understanding regarding the change over to PPL as the new fiscal intermediary, if you wish to remain with CDPAP, you must change over to the new fiscal intermediary. And to do so, members or designated representatives will have to sign the new memorandum of understanding. Many of the people that, as Wendy had said, have already done this process, begun this process, or actively in this process. The CDPAP workers will have to fill out documentation. They'll need a physical. They'll have to go through trainings. PPL will pay for physicals if they already had one or if it's expired. CDPAP workers will have to complete training at no cost and will be compensated for that time. And the members, designated representatives, are encouraged to attend PPL's information sessions to learn more about this process. So as Wendy said, their website has links to everything. We've included a couple of links at the end of this presentation as well for reference for folks.
Yes, and I just want to point out, we mentioned like 3 different dates to you, and each one relates to a different group, right? The no later than March 28th, 2025 is for members and designated representatives. The March 31st was for, or is for, the agencies that did or were providing CDPAP. And the April 1st deadline is overall for the state as to when the program officially launches, right? So please be mindful of which kind of due date relates to you. So how do members or designated representatives and their aides register with PPL? There's several options available. You can transition over the phone by calling their customer support center. And again, they're running 6 days a week, 8 to 8. So, they're open for a nice amount of time throughout the week for you to call. There's also transition online. You can use the PPL at home online system. You can transition with a CDPAP facilitator. These are community-based organizations located throughout New York State. They're listed on their website. So if you're not sure who a CDPAP facilitator may be, you can just go to the PPL website and they have a full list there for you. Or you can transition in person. You can request an appointment for in-person support by emailing New York City, NYCDPAP at pplfirst.com. I know someone mentioned that they had been calling and it was a long wait time. So you have several options available to you. And of course, if you need assistance in connecting with any of these options, you have your provider agencies, you have your care manager, you have your current um, designated rep, or if you haven't started the process, whatever agency you had signed up with for your CDPAP should be able to provide some assistance in the meantime.
I will say, as a plug for CCOs, all of the CCOs are preparing information for their staff and are working on having resources available to assist if folks need it through training, through links, through frequently asked questions and guides. So if you are stuck, please reach out to your CCO care manager. If that CCO care manager does not know, that's possible. Escalate that to their supervisor because that information is there and present for all.
Yes. Thank you, Lisa. And as promised by Luisa, here are the links to resources. There's the PPL call center. The numbers here that you see are just for English and Spanish. There's actually several numbers available on the site for different languages. So if the families you support speak a language other than English or Spanish, please just visit the PPL website and you'll see all the toll-free numbers for each of the different languages that they have available. There's also the ny.gov website, which has information that talks about the differences between CDPAP and PCS, and of course the CDPAP PPL First link directly to their information.
So there's a couple of questions in the chat. I thought maybe we can pause for a second and address them.
Sure.
So I guess I'll start further up. Somebody had requested the information regarding the guardianship trainings. So I don't know, Jackie, Mary, if y'all can add the information for that on here.
I got signed out of my account, so I'll just sign back in and then I'll put it
Okay.
in. Thanks.
Thank you. Let's see. We also have questions about home of their own. That doesn't fall within this category. I don't know if anyone else on here has information regarding home of their own. I think that's more along the lines of housing.
Yeah, I don't think that program is running anymore.
Okay. I didn't think so either. I hadn't heard about it.
It's been a few years since I've heard anything about that program running.
Okay. Another question: can a parent be designated as a CDPAP worker? Potentially, depending on if that parent is the parent of a person over or under the age of 21, and whether or not the parent is the designated representative. So if they are the designated representative, that could be considered a conflict and might not be able to go through with that process, but they would need to check in with PPL. And as for the question from Michael, how can I apply for CDPAP? If you go directly on PPL First website, as soon as you get to the website, there is a big button on the top that says register for CDPAP services in New York. And you're able to, right from there, begin that process. Does anyone else have any other questions regarding this? Anything to share? Anyone successfully supported somebody or gone through it themselves successfully already? I know, Jackie, you had said you're in the middle of it. But if anyone else,
I was just about to raise my hand.
Go for it.
So I am my 25-year-old son, CDPAP worker. I can do that because he is over 21. I will say that people who are newly applying, again, I don't know what PPL is going to do, but in terms of the old requirements, frequently what happens is when you try to do it as a parent of an over 21, they will tell you you cannot be the worker because you are either the representative payee through their Social Security account or you're their guardian. And for 2 years, I was dissuaded of doing it because those were the emails I was constantly getting, but that is not true. It is your right to be their CDPAP worker if your person is over 21. So I just want to say to people, don't give up if you hear negative at first.
Great, thank you, Jackie. Out of curiosity, was the phone or email or in person, one of those methods work best as far as connecting with PPL?
Are you asking me?
Yes,
Yes.
Jackie, sorry.
Oh, I still have not managed to onboard completely with PPL.
Okay.
Basically, I mean, and I'm summarizing from the different groups I'm at, most people are finding it very frustrating because phone calls and messages are not being returned. What happens is you call the number, you stay on hold for a little while, then they say, there's a very big line, would you like us to call you back? And you leave your phone number to call back, and I have not gotten that call back, and I've left several messages. It is helpful to use your facilitator. My person is Chinese American. It's one of their facilitators. They were able to help me through to a certain point, which was very helpful. So I definitely recommend that. But then at a certain point, PPL has to take over. And that's what's been a little bit difficult with the timing. Hope that helps.
Thank you, Jackie. Anyone else on here have questions or anything they'd like to share?
I will say this, and from what Jackie said, you know, you definitely don't want to leave it for the last minute if you still have to do the transition, because it's already March 12th. Jackie mentioned, obviously their phones are very busy, because if the call center is open 6 days a week for 12 hours each day, and they're not being able to get back to people, or there's an issue with the system, you want to give yourself time to really be able to connect with someone that can assist you to go through this process, right? So please don't leave that for the last minute, because then you will see delay in services, and nobody wants to see a delay in anything. So just keep that in mind. And Stuart, I see your hand up.
Yeah, thank you. I couldn't see my hand up. That's why I put it up and down so many times. Thank you. I wanted to ask Jackie if she could talk a little bit more about her experience with the designated rep distinction and her experience.
Sure. So I'm coming at it from the adult world, from over 21. So the worker cannot be the designated representative. So my husband is the designated representative, and then you need a backup, which is my sister. So I'm exclusively just the worker. So anything that's oversight between the person who's receiving services and the FI, which will now be PPL, but prior to this was 600 different FIs, that's handled through the designated representative. The word I use,
Yeah.
I don't know if it's confusing between designated payee, which is the role you play with your person's Social Security. That's more the banking relationship. Designated rep is the person who is overseeing the relationship between the individual and the CDPAP worker. Does that make sense?
A different person has to be the point of contact with the fiscal intermediary as the representative of that person receiving the CDPAP services.
Yes, exactly.
Yes, no, I understand. The reason I ask is because I see designated rep being used relatively loosely on a lot of documents in the CCO world. And so I was just sort of like, parent beware, be careful how you sign and know what you're, understand what everything has a meaning. And so that's what prompted me to ask you that.
Oh no, Stuart, you're making a great point, and I think Luisa touched on this also earlier, which is the whole alphabet soup thing, right? Even though this is a service that you may be getting for your loved one because they need that support, know that depending on the agency, the sort of different world that you're working in or looking for services in, the phrasing may be different. It's care manager versus case manager, right? Social worker versus your advocate, the designated payee versus designated representative. There's a reason why they use different phrasing. It may just be that out of 9 things provided, just 1 or 2 is different, but that 1 or 2 makes a world of difference, right? So don't be afraid to ask questions. If you don't understand what's being provided to you, do not be afraid to ask questions in the moment. I know a lot of the people we support are so used to having documents put in front of them and asked to sign. But you should always be asking, well, first of all, you should always read it if you can. But if you can't, or if you have and you do not understand what you're being asked to sign, please do ask for people to review it with you. That's why we all have the work that we do to assist you to understand the different services and what it is that you're being offered and what it is that you're agreeing to, right? From Stuart to Luisa to myself to Del and on, that's what we're here for. So by all means, please don't be afraid to ask questions.
I see a hand up. Dylan?
Yeah.
I'm asking this question as a mom, not as a community. So my son, he receives like home health services through a care agency, I guess. It's the Americares. So will they let me know like what I need to do? Because I don't think I've heard anything from them, but now I'm like, oh, should I have heard something by now? I don't know.
You would have only heard something if your child is signed up to receive CDPAP services. If you're in
Okay.
one of the other services, nothing's happening, nothing's changing. There's
Oh,
no
okay.
no direct effect. It's just for the folks that were enrolled in the CDPAP program.
Got it.
Those
Okay.
are the folks that are affected, but nobody
Okay.
else is being affected by this right now. That's not the change that's happening.
Okay. Thank you so much. Thank you for clarifying, guys.
You're welcome. No problem.
No problem. Yeah, we wanted to mention the different types of caregivers because, so many people use the phrasing interchangeably. But mostly I know from the situation with my grandmother, and that was even before I started working in this field, we just called everyone home attendant. We didn't know that there were, different types of caregivers. We're like, oh, that's the home attendant. To be honest, now that I think about it, since it was my aunts that dealt with it most, I'm not sure which category she would have fallen. Definitely not CDPAP, but I'm not sure which category she would have fallen under. Never saw her provide medication, so I'm gonna assume personal aid or personal assistant, but uh just mention those caregivers because of that. But again, this is really just dealing with CDPAP. So if you weren't enrolled before, this wouldn't affect you. And if you're interested in enrolling, then this is what's going on.
So I saw in the chat, designated payee equals
Yeah.
banking, designated rep, not necessarily, right? And again, that's the trouble with this. When it comes to Social Security, if a person is receiving SSI, they are a child or they are a young adult that needs assistance with representing of self, there might be a representative payee. That person might be the person that receives the check on behalf of the other person, so that they can handle the banking and the management of the money. That has to do with Social Security. When it comes to the CDPAP world, the designated representative is the person that is making the decisions about service with the fiscal intermediary. They are not the person that is doing the service, meaning if I am the parent of a young adult receiving these services, myself and my spouse are providing care. I would be the worker for my child. I'm not the designated representative. My spouse would be the designated representative. They would sign the consent for those services and things like that with PPL, with the fiscal intermediary. I would not do that. That doesn't mean I'm not still that person's parent. I might still be that person's representative payee through Social Security, but I'm not their signer. And I think to Jackie's earlier point is because those terms kind of overlap and it can be a little bit confusing, folks might assume that they mean the same thing, but they don't. Hopefully that helps. Alphabet soup, I tell you.
Truly.
And then we have parents of children versus young adults, people that are or aren't their legal guardian. There's always some degree of confusion with that, the different types of guardianship.
And I do just want to say, probably you all know this, but I think it's worth saying. You're an adult when you're 18 years of age or older. I know we're very used to making decisions for our children, and if there's no change between 17 and 18, it's easy to think, oh, I can just continue to make decisions. But that's why you have options like guardianship or supported decision making, right? Because legally, they are considered an adult and as such able to represent themselves. And if it comes to the need to have certain documents signed by law, because they are considered adults and there is no guardianship or supported decision-making plan in place, they are expected to make decisions and sign documentation for themselves. So just something to keep in mind. Which brings us back to the workshop that the Manhattan Family Support Services Advisory Committee, that is a mouthful, will be having later this month on guardianship. I know that Mary put in her information there, her email, so please be sure to reach out if you're interested in participating, because you do have to attend the first one in order to be able to attend the second one.
And actually, I think we're gonna you're gonna need OPWDD eligible. Oh, I'm gonna take that back. Hold on that. You're welcome to attend both.
Thank you, Mary. Any other questions? Oh, I see Elizabeth is asking, is it like a healthcare proxy? Will you have a second Zoom? I missed my alarm. Please share the email.
For me, for our thing,
Yes, yes.
in one of the forms, I think she goes over the healthcare proxy. I'm trying to remember. Jackie, do you remember in her last one? I think that's in one of the forms.
I think she
not,
touches on it, yes.
Yeah, and if it's not, we can ask her to add that, because that's a simple part of the guardianship, that you don't need guardianship to have a healthcare proxy.
Correct. All right, all. I think that we have reached the end of our presentation. Thank you, everyone, for questions and for all of your contributions. Hopefully, Wendy and I left you with some information that you didn't have at the start of this. and that you have some resources to take away with you at the tail end of our presentation. Please make sure you join us next month for our joint meeting with the family support group and learn about some of those resources for reimbursement that we don't want to go to waste, right? If you don't use it, you lose it. And we want to make sure that we have everyone taking advantage of the resources that are out there right now, because that changes from year to year, y'all. What's covered, what's reimbursed, what isn't reimbursed is something that definitely changes. So,
Right. In fact, with CDPAP people, they're not actually allowed right now at this moment to use family reimbursement, but that is in the process of being changed, that you can use it for goods and services, but it's not in effect yet. You know, so keep posted, and things like with family reimbursement and the ADM that have allowable and a lot non-allowable lists. If you reach out to us with your concerns about a certain item or a certain class, we can bring it to the attention of the family support committee up in Albany.